Good afternoon, everyone. My name is Lisa Cox. I'm the Communications Director at the Missouri Department of Health and Senior Services. Thank you for adjusting your schedules and taking the time to join us today. Normally we meet on Thursdays, but we have a special session today. I'm joined virtually today by a panel of members of Missouri's interagency COVID-19 vaccine planning and leadership team. If this is your first time joining, we do have recordings of past webinars linked to our website, your resource hub, mostopscovid.com/vaccinators. So those are available for viewing at your convenience. Today's session will also be added here probably a couple hours after we wrap up today. Please feel free to drop your questions that you have in the chat box. We will end this webinar by 4 p.m. and work to address as many questions as possible. I would like to now invite Ted Delicasse to come on the line. He is supporting the state's COVID-19 response. Ted?
Lisa, thank you so much. And can you hear me, ma'am?
Got you. Thank you.
Wonderful. And as everybody is probably well aware, the time of COVID means that we're doing many different things all at once. So I do want to invite Adam Crumplis, if he is able, to come on and offer a couple of thoughts from Missouri's leadership about what we're trying to achieve here and what we hope to get out of today. Adam, if you're able to be with us, I'll give a pause there.
Yeah, thank you, Ted. Really appreciate the opportunity to speak with everyone yet again this week. Just a few things I want to highlight. We are continuing to receive an exceedingly limited supply of vaccine. Recognizing that fact, as a state, we want to make sure that we try to plan forward and engage as many different participants, vaccinators, and individuals that wish to be recipients of vaccine to help build out a bit of a structure and an expectation for clarity so that everyone knows exactly how we're intending to approach the distribution mechanisms throughout the state of Missouri on a going forward basis. As you're probably aware, we have recently placed out for public view a map of all the vaccinator locations across the state of Missouri. We recognize that some individual groups may not intend to vaccinate further beyond their employee sector, but we felt it was important to go ahead and put all that Show Me Vax registration data out for public consumption. Keeping in mind that we want to be as transparent as possible, Ted is going to walk through a presentation today to help outline both our ordering cadence of how we go about the process of making sure we get the allocations from the federal authorities and the time sequencing that we make decisions on those bases, as well as helping to provide some transparency and clarity for everyone to be able to understand the proposition by which we're moving forward for some of the vaccine allocations. Certainly, the three things I would highlight about these things that you're about to see from Ted's presentation. Number one is, while we want it to be transparent, we also recognize that we reserve the right as a state to monitor and see how that process is working and make adjustments or transition as necessary. Number two, I would just highlight that we recognize that when market supply is as constrained as it is, we are not going to be in a situation that everyone in the marketplace will be happy, but we recognize that the most important part of what we're asking from our vaccinator partners is that you work as a community across not just the spectrum and lines of your organization, but with other partners in your community to do the best that you can to help ensure vaccine reaches those Missourians that are in the Tier 1, 1A, 1B Tier 1, and 1B Tier 2. The third thing I want to highlight is we also want to ensure that we're looking at vaccine distribution equitably and really taking into account various key components of ensuring that we are distributing the vaccine to those with the greatest needs, as well as trying to keep a sense of balance and continuing the balanced approach in the COVID response that the governor has set forward for the state of Missouri. So as you go through this presentation today, please bear in mind that we recognize that it will be a work in progress to continue to grow and evolve, but that this is the first step in helping to engage everyone to get a much clearer picture of how we anticipate making decisions as we're going forward.
Adam, well said, sir. And a couple of points there that Adam hit that is very important. As everyone knows, you have plans and then the pandemic showed up, right? So we see this as our best planning attempt as the reality is currently. So please see it as such. And our plans are going to continue to be informed by you, who are the leaders on the ground carrying them out. So please use that chat function. Do not be shy about asking questions. We will likely not get through all of them today. However, we do commit to making sure that there is no ambiguity out there and we can resolve the lingering questions you have so you can go forward with the confidence you need to serve your communities. So with that, I'm going to jump right in, folks, and I'll give pauses at different intervals so that my team can let me know if there are questions that need addressed. This first part gives us an idea of what we hope to achieve today. And that comes in a couple of buckets. And so these first couple points here, design principles for Missouri's allocation plan, is us informing you of how we see the values that underpin our plan and guide our action. And then from there, we want to provide you with some information if it hasn't been explicit for you. To that point Adam called out, we've had a scarcity of supply and an overwhelming demand, and that incongruity makes for a lot of unhappy folks. However, we think if we can start being more explicit about that incongruity and that asymmetry, at least there will be understanding about how limited the supply is and how large the demand is. And then we're going to jump in to how we conceive moving forward. And so that first part is about informing, and this next part is about explaining the plan and welcoming your feedback on that. And so that's what you're going to see when we start to discuss what we believe our primary delivery channels are to get vaccines to folks as quickly as possible. And sometimes I think people see quickly as being overly technocratic. We believe the efficiency by which we can get those eligible populations vaccine is a key component of equity, because if vaccines are staying on the shelf, they are not getting to the people that need it the most. And then finally, the last 2 points are more about what you can expect over the month of February, both in terms of planning and expectations, as well as communications from the state. So with that, I'm going to jump right in and we're going to move into the informational part of this session. And that starts with the principles that underline our plan. First and foremost, it has been the lodestar from the very beginning. That is to simply save lives. And that's what most of you here show up to do every day. And so those two sub buckets under Save Lives focus on two distinct ways in which our current eligible populations help save Missourians. The first one for Phase 1A and Phase 1B Tier 1 is to protect our healthcare system and those first responders. And then Phase 1B Tier 2 is to prioritize Missourians most at risk, who are most at risk of fatality or serious issues with the disease. So again, eligible populations we currently have activated as a state: Phase 1A, Phase 1B Tier 1, and Phase 1B Tier 2. And we move on from Save Lives to fair distribution across our regions. And I won't belabor this point because there's going to be a slide that makes it very clear. And that is, we know we have a varying degree of population with different pockets across the region. And so it is a commitment of the state to make sure that we are fairly allocating that distribution of vaccine across the state. And I hit this point for number 3 at the previous slide, and that is, if we cannot get vaccine off the shelf and into arms, then we will never have an equitable distribution. And so that's where number 3 comes from. If you are a vaccinator, we expect you within the week that you receive that vaccine to get it out and to get it into arms. And we realize that that's a two-way street. You need the expectations and the clarity of planning from us in order to do that. And so we're going to talk about that in some later slides. And the last two are in the vein of what Adam was discussing, and that is the picture is never going to be perfect, and the plan is always going to be out of whack of what is going on the ground. And that's where flex to fill gaps comes in. As we use our analysis to identify who is receiving vaccine, we are hoping to also realize that there are seams and gaps of who is not receiving it. And that's where number 4 comes in, making sure we are allocating appropriately to fill those. And then the final one is the one that Adam hit home. At any time, this could change. We are at the whims of the federal government for both supply and for planning, and they are the ones providing the guidance. And so we need to be prepared to adapt. What that means for us is to provide you communication, and what that means for you is to be ready to receive that and to be a willing partner. And so I'll pause there. I see a flurry of activity. One point I will hit, I think as I saw in passing, somebody said it was disheartening to see Missouri as last in the nation for getting vaccines out. I won't quibble here about last in the nation. I do think that those numbers are slightly misleading. However, the broader truth is correct, and that is we're at the lower end right now. And if I would hope it goes without saying, everybody on our team takes that as a personal challenge because we know how hard you are working. And so everything you see here is directly born out of that. So rather than wallowing, we're deciding to do something with it. And that is the plan you see before us. Lisa, I'll pause there. Anything that you're seeing in the chat that you don't think is going to be addressed in these next slides?
I think if we could just provide some clarification on the second doses. I think there's still some confusion around that. If you or Adam want to touch on it.
Fantastic. And Adam, we will hit those in later slides. So Lisa, if I can encourage folks as we get to that slide, if it's still unclear, please let me know. And also know the state will be sending explicit guidance for those second doses later this week as well, because we are hearing that from multiple sources. So I'll continue to drive here and we will hit that later. Adam teed this up very well as kind of the bottom line up front. And that is, if you look at from when we started this in December and started to receive vaccine, our average weekly allocation for both Pfizer and Moderna hovers around 38,000. And so we at any given week are receiving 2 to 3 times that amount in order requests from upwards of 200 requesters. And we are only going to see that disparity, if our supply stays the same, grow as more vaccinators are becoming enrolled in requesting. So this week as a case study is probably going to be emblematic of future weeks, as we are seeing 350 plus requesters already for a supply that has not changed. And that's what that bottom box has told us. The supply that we have been receiving is likely to remain the same at least through February. And I know that's frustrating. And again, I will stress that we have no say in the state of how much vaccine we receive. So I will stress this again. And as I move into the next slide, I think the next slide takes a cut deeper here and magnifies that problem. If we think of our average weekly supply around 75,000 doses, we know that we have about 2 million eligible Missourians left that have not received a prime or a first dose vaccination from phase 1A through phase 1B tier 2. And so it's obvious to anyone who's looking that with only 75,000 doses each week, we are highly constrained in order to work our way through those remaining 2 million eligible Missourians. And so I want to make sure I'll leave this slide up for just 5 more seconds as I transition so that we can really understand the challenge that we are in and how selective we have to be with this constrained supply. And as I do move to the next slide, we will hit in later slides how exactly Missouri is going to step up its game in communicating these challenges so that the public can realize the constraints that we are under and that you are all also under and that we're under together. So you will see those in the coming slides. We talked about our second priority being parity across the regions. And as you can see here, these first 3 columns for Pfizer, Moderna in total are the percent of vaccine allocation by region. Again, these regions A through I, are the highway patrol regions that they use for emergency responses. And you'll see in later slides how we have used those regions as a model for the regional implementation teams. The purposes here, though, are to show Our allocation to date is plus or minus, if you look across these columns, plus or minus 4% within parity to the overall population. So to be explicit about that, if you look at what's been allocated to Region A, that's 3% off of what is their overall population. This is important. I think sometimes we have not fully understood who's receiving how much vaccination. And as you can see, the vaccination is mirroring the percent population of Missourians, so that there is no great disparity of somebody's receiving more than what their total population. And so I'll pause there, Lisa. Anything you see in the chat that you don't think we're going to cover too, or that is worth highlighting from these last 3 informational slides?
I don't think so right now, Ted. I think the future slides are going to answer a lot of these questions.
Wonderful, everybody. And I'm sure Lisa has already said we will clean these slides up for you and provide them as well. And you will see how we are also planning to increase communication as we move forward. So as I move into this next slide, I think it says it's important to notice we are now shifting from information to planning. And so given this constrained supply of 75,000 doses plus or minus that we have on a weekly basis, and the need to get shots in out in the chat that we have a lot of on-hand doses, we are focusing on those channels that can get vaccine into arms quickly, safely, and efficiently. So that's what you see here in these 6 major buckets. A couple of things that I'll call out: a high throughput healthcare system is not a scientific definition. It's a definition the state came up with based on in-state results, so based on outcomes. And those are healthcare systems that we believe can vaccinate 5,000 citizens a week. And we'll talk a little bit more about what that designation means in coming slides. So if you have questions there, please just hold on to them until we get to that. The Federal Pharmacy 1B program is not active at this time. We are currently discussing with our Federal Pharmacy program partners about some of the vaccine that they have and maybe how to use that more appropriately. So at this time, that is not active. FQHCs and other clinics are fairly self-explanatory. For those folks who don't see themselves as a high throughput healthcare system, we believe the bucket of all other community providers, which are essential and important, covers those remaining groups. LPHAs, additionally, important and self-explanatory. And finally, those mass vaccination events. I know folks have a lot of questions about that. So I see some questions coming in about high throughput and mass vax. So what I'm going to do is actually use the next couple of slides to explain those models. And then as I do that, please let me know if anything is unclear or if you still have remaining questions. So first, let's focus on those high throughput healthcare systems. These high throughput healthcare systems are the ones that we believe and have told us can do 5,000 citizens in a week. And so let's talk a little bit about the realities and the implications that are underpinning this idea and the logic of this system. We know that across all 9 regions, there are multiple healthcare entities that have this throughput ability. That means we know there's more than just one healthcare system in each region that can do upwards of 5,000 citizens a week. However, the implication here is you have seen that we only have 75,000 doses any given week. So that means with such a constrained supply, we're only going to be able to empower so many of these high throughput healthcare systems to receive approximately 5,000 doses a week. That's just a reality. And we ask for your consideration in that to realize that with only 75,000 doses, we can only give so much. Not asking you to be happy, just asking you to be aware of that fact in the way that you respond and ask your questions. And the second point here is, as I'm seeing folks raise questions, and that is we need to get doses into arms and within a week of receiving. And what that means is you all need the necessary planning and clear guidance from the state to know when you're going to receive how much. And so given those realities and implications, that has informed the state's strategy of choosing 2 sets of 8 providers spread across the state to receive 5,000 doses each per week. And you'll see in future slides what that looks like. So I'll say that again so that we can understand and visualize it. That means we're going on a 2-week cadence. That first week being 8 distinct providers receiving 5,000 doses. That second week, 8,000 different providers receiving 5,000 doses. Those two, that total group of 16,000 providers then would receive 5,000 the next 2 weeks. So they would go on a rotating basis. I will just stress, you will actually see this visualized in the coming slides. So if that is confusing, you will see that in front of you. There's a couple of points that are absolutely critical to understand here. If we only have 70,000 doses and we are going to allocate 40,000 of those doses to 8 sites each week, the state as well as the associations are going to explain that this will be a partnership. Those sites that are selected do not speak to the ability of other sites. It just means we had to choose 8 geographically distributed sites that had the ability. It doesn't mean sites not chosen did not have that ability. I realize that everyone has pride in their system. However, we have to realize with constrained supply, only so many can receive vaccine. If you have 75,000, you give 40,000 out, you still have 35,000 that will show where that's going to go to and how that constrained supply dictates. The second point we want to hit is sites. If you receive that 5,000 doses, you are making an explicit agreement with the state and its citizens to serve all eligible phase 1A through phase 1B tier 2 populations. So you cannot turn away folks if you have doses, and you will be a representative of the community. And then finally, the important point here is if we give vaccine to a site on week 1, and then when they come back on week 3, we will assess if they still have doses on hand. And if they do, from that original allocation, we will take that into account of whether or not we give them more vaccine. And I will explain further in the coming slides what on hand actually means. So please hold your questions on that until later slides. The final point there you'll see in red, this is our plan today. If the federal government comes to us tomorrow and tells us, hey, here's the new guidance, change everything, we will work on that as quickly as possible and update you. It's just, we can't stress it enough that we are trying to relay information to you as quickly as possible as when we're receiving it. So Lisa, I'm going to abstain from any questions right now until hopefully they can see this in later slides, and then we'll open it up for more questions. So moving from the high throughput plan to the mass vaccination sites. So if it has been confusing to this point, the regional implementation teams, those are called RITs. These regional implementation teams, there is one per region, and those are the regions you see on this screen. They were specifically chosen as community members who live in that region and work in the healthcare community and are specifically designated to help set up regional events to serve those who are underserved in the healthcare community, meaning that they have restrictions and less access to healthcare. And so they show up over the next couple of weeks. They will run 9 RIT-led events each week, 1 per region. They will do those 9 events over 3 weeks for a total of 27 events, meaning that if I focus on Region H, Region H's RIT team will do 3 different community mass vaxes over 3 weeks. And each region will do that for a total of 27 events. At the end of those 3 weeks, they will go back to the first sites that they did and start administering the boosters, those second shots. So that is the model. What that looks like from a supply standpoint is each event will receive 2 trays of Pfizer, so 975 doses. That means that All 9 events each week require 17,550 Pfizer vaccines to support. These are events that are planned, and you'll hear more about them. You'll hear specifically about the 9 events this week from the RIT teams, and you'll hear more about all 27 events very soon by the end of this week. The reason that I stress this is because as we move down into this next slide, it shows what we know for planning guidance. And that's critical because what I want to stress is the overwhelming reality that you have asked of us from the state is to give you certainty about what you can expect, even if that is you can expect nothing on a particular week. And so this is in direct response to what you have asked, to the constraint of our supply, and to the need to increase our rate of vaccines. Those 3 factors are what influence this decision. Now, I'll show here, if you look at the left side of the screen, it goes to show 8 sites on the week of February the 1st, 8 different sites on the week of February the 8th, and then those week A sites show back up on the 15th of February, and those week B sites show back up on the week of the 22nd of February. And as you can see, if we look on the right side of the slide, everybody, we're going to use 40,000 doses for high throughput healthcare systems arrayed across the state on a weekly basis. We also know we are going to do 9 regional sites on a weekly basis. That puts us at about 58,000 or 57,000 doses on a weekly basis. Plus or minus, that leaves 20,000 or so doses that can be allocated each week. Now, we are fortunate in that we will know by the end of the week where those high throughput healthcare systems will be, and we will know where those mass vax events will be. And so it's explicit in the state's planning that we will use those 20,000 remaining doses, give or take, to help array them around the region to provide as much equity both regionally and to communities that are not being served by these 2 main pillars. I'll be explicit there, and then I'm going to go to the next slide. I'm going to show you the other delivery channels that we talked about and how we're going to spread the remaining plus or minus 20,000 doses against those. And then I want to open it up to some questions that Lisa can have. And so before Lisa starts to compile those questions, just showing you here a couple of call outs that are different. We add the FQHCs in clinics at about 8% each week, so 6,000 or so doses. All other community providers at the same percent, as well as LPHAs at the same percent. And the final call out piece there is that we will reassess at every week, because if the doses are not being used by those delivery channels, we will empower a delivery channel that can use them. And so I will pause there. Lisa, any questions that you think are not being addressed here and that we should speak to specifically?
I think there are some questions about the National Guard's role, what they're responsible for, and what that looks like overall.
And that's a fantastic question. And I know my colleagues who are helping run that, Jonathan Gorut, as well as Colonel Cole. I don't believe either one of them are on. However, if there is someone from leadership that wants to speak to that, I can also fill in some details as well.
Ted, this is Adam Crumbliss. I can talk to that. So the National Guard is helping DHSS to execute and plan across multiple lines of effort. In particular, the most visible that you all will be seeing the National Guard in the media and others is in relation to our regional implementation teams. The National Guard has men and women that are willing to stand up and assist in the effort of helping these regional vaccine events, mass vaccination events that are put together in conjunction with local public health agencies and our regional implementation teams stand up and support those events. And so while they have a very prominent role in those events, those are ultimately going to be operative through the regional implementation teams and our partners in local public health. And while those are the 2 primary channels, we recognize that there may be other supporting roles in other portions of the lines of effort that we're talking about today that National Guard may be able to help stand up and support as well. So we certainly want to highlight their role as more than simply being the support mechanism for regional implementation teams or mass vaccination events. But those are the two primary delivery channels that we anticipate at this time that they'll be working with us on.
And Adam, there are also some questions about what registration looks like for these clinics. I know the regions, the teams in those regions are doing things a little bit differently right now as these get started, but that could kind of adapt with new technology that we're bringing on board soon.
Lisa, thank you for that. So in particular, that is correct that right now what we're seeing is a lot of the different local public health agencies that we are working with do those event registrations a little differently in each part of the state. We are also in the process of establishing a system to assist for registration, especially in those communities that otherwise don't have a technology system to support that sort of activity. So the objective of getting the registration through that technology system that DHSS will be standing up is really to help uniform implementation statewide. But again, that is certainly something that the local communities and local public health agencies are not required to utilize at this time.
Great, thank you. Go ahead, Ted.
Lisa, the only point I was going to draw out here is to Adam's point, this visual complement. The Missouri National Guard is primarily supporting those RITs right now and will be helping with those 9 events each week. And realize there's some confusion still around that model, and we may be well served. We will push out more information this week so that we can help clarify that for folks. Lisa, you seen anything else that we should speak to before we move on to some further guidance and clarification?
Don't know if you want to touch more on the high throughput sites. Like, for instance, there's one question: how close will the regional implementation team event and the high throughput sites be? And then will the state be sharing that list of high output healthcare organizations and regional implementation teams to share with their constituents?
Gotcha. So Lisa, let me take those in a couple of steps. And so the first one is when we say how flexible, are we talking about will that be changed, or how flexible are we in defining where those will be? If it's the latter, what I'll say is the mass vax events, those 27 are being finalized this week. So we will have 9 events each week. They will be the regional implementation teams. I'll go back to that slide. On the regional implementation team side, the 9 RITs are finalized, and we can circulate that information from Jonathan Groot, who is helping lead that. Where they are doing their events this week can be circulated. I know Jonathan is working on that. And then where all 27 events will be circulated as soon as we have that. Specifically to the point on flexibility, if that was in regards to whether or not these will be changed, these events will receive, as this is our current planning guidance, these events are planned and we plan to execute them. So that vaccination will be apportioned accordingly there. Lisa, do you think that answered at least the RIT and mass vax question?
I think so, but feel free to ping us if that didn't cover if your questions didn't get covered there. Thank you.
And then in terms of the high throughput, we have met, I would say we've had 10 or 15 meetings with various health members as well as health associations and regional leaders across the state. And we have taken their input on why the high throughput healthcare makes sense and how it can help us get the most vaccinations to the most people. Now, who exactly those 16 sites are going to be is still being deliberated right now. If you have input on that and you believe you have insight into what site should be considered for that 5,000 throughput in a week, please feel free to provide that to us. We are going to take all of those considerations into effect as we finalize those 16 sites. So we will, as I said, be providing those 40,000 doses. To whom we are providing them, we are still finalizing. And so, Lisa, I hope that clarified the certainty of what we do know. What are the other questions that you're seeing?
Can you go back to the slide? A couple questions wanting to see again on the remaining 20,000 doses.
Yes, of course.
The next one. Okay. Give it a minute there. And then there's also some questions about the regional implementation teams. There will be more information forthcoming on our website about how to get in touch with those partners, who they are. Adam, did you want to touch any further on that piece?
Yeah, I would just say that one of the key things that we want to stress with the regional implementation teams is the impetus and design behind them is to ensure that the continued partnership moving forward of multiple local public health agencies, along with those in the healthcare provision sector, continue to grow and be coordinated. One of the things that we have learned in the pandemic that we're moving forward through is that the more integration of communication and planning across both the public health sector and the healthcare delivery model that we have, the better we will be overall for the whole state.
Adam, well said. Lisa, if I can, in no way, shape, or form pivoting away from the regional implementation questions, if folks can continue to compile those, it is not to say it's not important. It's critical. However, we don't have the leaders of that team here to give you more specifics right now because they're currently working on some of those. We may have to set up another call as such to specifically speak just to those, if that is okay.
Yep, sounds good. Yeah, I think we can move forward, Ted.
Okay, wonderful. If that is the case, folks, we're going to move into a bit of guidance, and that is we've heard from you several questions that continue to come up, and there's some through lines, and so want to make sure that we touch upon those. As one administration left and another administration has started, there was some confusion and some complication around federal guidance. And so I'm going to try to be as specific as possible here. And if it does not give you clarity, please let me know. So when it comes to second doses, or what are called boosters, realize there's been a lot of confusion around this. The state still orders boosters on behalf of the vaccinator. Now, the implication there is boosters, as of today, are still separate in the ordering process, meaning that that first dose you give has a second matching dose, and you will receive that second matching dose. That means that you should not be holding on to any doses as booster doses, and that as of today, and again, we don't control supply, so if tomorrow we receive something different, we will update you immediately. But as of today, there is a matching dose that will show up to you. Now, the wording around that can change, but that is operationally how it is still working. And so I hope that is clear. Nothing has changed for you all. If you give that prime dose, you should still plan on a second dose coming to you and giving that booster dose to that individual. And so really encourage folks not to hold on to vaccines, to give those first doses as first doses, and then to give second doses as second doses. The one piece here that I'll call out, but we are not going to discuss just because it is very complicated, is that unused second doses. Realize that's becoming a bigger and bigger problem as folks who receive their first dose don't show up for their second dose. I won't get into here why that's such a problem. However, we want to support you. And so the state is going to release more guidance on that this week. Hope that brought clarity. If it has not, please drop further questions in the chat. The second point here is there is still a significant number of providers who are not reporting vaccine. And that shows up in a number of ways, meaning we have shipped them vaccine. They have not uploaded their inventory into Vaccine Finder, nor have they uploaded it into Show Me Vax. That's a problem for a lot of reasons, chief among which that is probably most important to you. If we cannot see what vaccine you have in your inventory, we are likely not going to send you more. And so if you are having troubles, we completely understand. Operational challenges show up all the time. However, we need you to report both inventory vaccine and those administered vaccines. And so if you are having trouble doing that, please, please, please reach out to the state, because not reporting is simply not an option. And finally, this has been a huge point of contention. And so I'll take some time here to be as specific as possible. You have vaccine in your inventory. From now on, when we talk about on-hand vaccine, on-hand is so important because, as you saw, we are far down in the ranking as of this week for doses administered, meaning prime doses administered, meaning we have a lot of doses sitting that are not in arms. It is unfair to call anything that is in your inventory on hand. So what we are going to start calling on hand are doses that are older than 7 days. Now, here's why we think that is fair. If you receive vaccine, we expect you to administer that vaccine within a week. So if you are ordering vaccine, only order request what you can do in a week. Anything older than 7 days, we will consider as your on-hand total. And if you have a large on-hand total, it will decrease the likelihood of your order request being fulfilled. Realize that's a little different when we talk about boosters. And so what that means, hopefully, is clarified by that picture down here. And that means when you receive your booster, we don't start counting. We start counting at your 21 or 28 day mark. 7 days after when you should have started vaccinating at that 21 or 28 day mark, if you still have boosters, we will then consider those on hand and consider them against your future orders. Again, this is not punitive, everybody. I hope we can all understand the urgency of getting vaccines into arms. The one call out here that ties in between on-hand definition and unused booster guidance is we realize that there are going to be folks, sadly, that don't show up for their second dose. Again, we will send out guidance later this week about that. So Lisa, I'll stop there. Are we seeing questions that are still confused?
Where is the new on-hand number being reported?
Where is it being reported, as in where are we pulling that information from, or where are we communicating who has vaccines technically on hand?
Chart, let's see.
I can answer them both if that's helpful.
That would be great. Thank you.
No worries. So when you are a vaccinator, you're enrolled in Show Me Vax. You're also enrolled in Vaccine Finder. All of our information comes through Show Me Vax. So you put your inventory in Show Me Vax. We're using that. And then whenever you vaccinate, you report those vaccinations through Show Me Vax into the data lake. I won't get too far into the weeds, but if you're not doing that, that's a problem. And please reach out and we'll help you fix that. And so those numbers of on hand, we pull from that data set. And I believe Linnell is on. Linnell, if I am off at all, or if I'm generally correct, that is good. That is the first point. We are pulling that from Show Me Vax and Tiberius data. And then the other point being, we are going to, as a state, to start communicating on the state's website, the COVID vaccine website, who has vaccine on hand that is older than 7 days. That is currently being built out and will not be live to the public until next week. Again, not punitive in any way, everybody. These are all steps we are trying to take to be more transparent and to provide you with the information and the public with the information that empowers them to make decisions and to coordinate and to plan. Hopefully that helped. Lisa, are you seeing anything else as we're coming up to about 15 minutes left?
Yeah, if we could go ahead and go to the next ones, and we'll come back if we have time.
Gotcha. In the next couple of slides, folks, as I transition, it's important to know we are going to explain what the state operation rhythm and cadence looks like, just so that there's no confusion for you all about when we know what we know. And so we run data and analysis on Monday that looks at the historical impact of vaccine to that date. As I hope you can see here, we're running analysis all the time and using that analysis to inform our way forward. On Tuesdays, anywhere between 10 a.m. and 1 p.m., that's when the federal government gives us our projected allocations. So we don't know next week's supply until that Tuesday of, and that Tuesday the week before. So that is what's going to inform the next slide that I'll speak to. You all know very well the order request deadline is 5 p.m. on Wednesdays. And we will have a bit of a change for how you go about order requesting, and I will call that out on the next slide. We will look to finalize orders between Thursday and Friday. And what we'll just call out, when you're getting upwards of 400 order requests, it's a lot to work through. And we're not asking for sympathy, we're just asking for understanding and trying to provide clarity. So that could stretch from Thursday into Friday and even into early Saturday morning. And so where you see that submit there, it is our goal to always submit orders into VTRAX, which is the federal ordering system, by Friday. However, the reality is that sometimes that stretches into Saturday, and if it's a huge volume, possibly Sunday. But I will say there that we will always have those orders in before they are due, so that it will never prevent shipment. And again, orders start shipping around Sunday, and they will arrive anywhere between Monday and Wednesday. I won't sit too long on that point, because that's after we submit that order, it's out of our hands as to what we can do to get vaccine to you. If we could, we would get it there quicker. However, this slide specifically is just focused on what the state is doing when and what we know when. This next slide, I think, is a bit more important to you all, and that is what you can expect on a weekly basis. So we are going to start updating our data on Mondays. We have a public dashboard that is going live today or tomorrow. Really would push you towards that, as well as that vaccinator map, where citizens and vaccinators can find who is an enrolled provider. That will is updated frequently. However, we can promise it will be fresh on Mondays. As I said, we are going to change the weekly town halls to Tuesday, so that we can specifically tell you at 3 p.m. every Tuesday how much vaccine has been projected to Missouri for that week, as well as provide you the clarity to the extent possible of who will be receiving what, to the extent that we know. This is a market uptick of transparency, and we believe it's necessary to provide you the expectations needed to effectively plan. On Wednesdays, again, all order requests must be in by 5 p.m. And as another step of transparency, Lisa's team will be publishing the number of order requests, the number of requesters, and showing that disparity between the number of requests versus the number that is projected from the federal government. And so that is another step towards transparency and providing you with the information so that you can let your constituents know that we are working with such a constrained supply. The last couple of buckets here being, we are working over that Thursday and Friday to finalize orders and submit them. And again, we are going to take another step in transparency of releasing on the website who is receiving how much. In addition to that, we will also be publishing between Friday and Saturday in addition to who will be receiving how much, we will also be publishing who has on-hand doses that are older than 7 days. So it's important that I hope everyone here sees that the number of new transparency mechanisms we are seeking to use to provide you with the information that is hopefully more helpful for you to plan and for you to point your constituents to if they are confused, which we understand this is a confusing time. And all of this is planned to start building out next week. And so appreciate your patience as some of these may be rudimentary when they start, but we will continue to polish and evolve them. Lisa, 2 big slides there. I'll leave it here because it's a bit of the most important information about what they can expect to receive communication-wise. Are you seeing questions that we should address?
No, I don't think so. I'll just add to that that this information will be where pretty much all of your resources from us have been so far, mostopscovid.com/vaccinators. So look for that edition coming next week.
Hey,
wonderful.
Lisa, this is Rob Nodell with the governor's office. I just wanted to answer the one question that was on there about the, having enough equipment in the packages for the 6th dose of Pfizer that is coming, that vaccinators are able to get. And we were told by Operation Warp Speed in the White House today that they're going to begin sending enough materials for that 6th dose. So that was an assurance that in forthcoming shipments that will be in there, so you can plan for that. Just to close the loop on that question. Thank you.
Mr. Nodell, very helpful there. And folks, that's just an example of Mr. Nodell was literally on that call today, and that is guidance that just came to us. So we appreciate you being here so we can relay that. And I hope it just goes to show we are literally getting the information sometimes almost as the same time that you are. Lisa, in that case, what I'm going to do, ma'am, is I'm going to go to these last 2 slides. And these are just specific bullets, folks, that address some of the most common questions that we're hearing. And I'll just repeat them because I do think repetition ingrains in us the main messages that our vaccinators are asking about. That is, all order requests must be submitted by 5 p.m. each Wednesday. And I pause here because we talked about a new way of order requesting. So currently you're submitting order requests via email. We are working on a web form that makes it fillable, makes it a single page, and that will help our back-end processes and simplicity for you. You will be seeing that change this week. So continue to send your emails. Nothing changes this week. However, after the deadline this week, we're going to roll out that new web form for next week. I realize change can be a bit scary. However, the web form will make things easier. We will make it crystal clear where you can find it. And we will push that out in both the newsletter and multiple emails so there's no confusion. Again, can't stress this enough. Enroll and report. Enroll and report both to Vaccine Finder, and you have to be enrolled into Show Me Vax in order to even receive vaccine. However, it is critical that you report to both Vaccine Finder and Show Me Vax. Without that, we have no clarity into what your allocations are. And that is part of the reason why we are so far down that list. Unreported vaccinations, while they do count to the person you help to vaccinate, are part of the reason that we have such a low number in some of those national headlines. A very tactical piece that is very important. Always include your facility PIN number whenever you are discussing or reaching out to us for clarity. It helps us so much look you up and to facilitate the conversation without us having to dig through Show Me Vax. Again, it says order request what you could perform in 10 days. What we're going to continue to stress is the standard is 7. If you haven't gotten through that in 7 days, we consider that to be problematic. And so really encourage you to think about the doses you can get through in 7 days and consider that your standard and the Missouri standard. The last 2 here, only order request 1 vaccine, please. Had a great question today about this, that sometimes there's some ambiguity or some confusion about, well, I don't know exactly what vaccine that I should order, I'm happy and our team is happy to help you with that. And we can outline maybe next week this week's newsletter, what vaccines best serve what conditions. However, you will not be considered for 2 vaccines. We will only consider you for 1 vaccine. And then we've already talked about the on-hand guidance, and we will provide further clarification about that with that booster and that second dose guidance that will come out later this week. So I'm going to pause here, and I know that normally quietness during a presentation seems awkward, but I want to take 30 seconds. And if you need any other guidance or you have any other questions, please go to the chat right now and submit those guidance requests and those questions. And I'm just going to give 30 seconds for everybody to do that so that we can gather as many of them as possible. Another 15 seconds, folks. Please just really push those questions. They help us so much to best serve you and to provide guidance. And folks, before I throw it over to Rob Nodell, who's been a truly effective executive leader on this event, I do want to say, please look out for another invite for next Tuesday. We're at Tuesdays at 3 p.m. Hopefully you don't get sick of me. However, we are going to do everything we can as a team to provide you more information and to field more of your questions. And then please continue to send feedback and questions. And then finally, for me, as I throw it over to Rob, thank you for what you do. We are not lost on, it's not lost on us that this can seem like a stale conversation when we're only talking about numbers. These are people, and you are literally saving lives with every vaccine. And you have no idea how humbling it is for our entire team to be in support of you, the main effort. And if that sounds a little bit hokey, sometimes cliches are also undergirded by truth. And that's the truth that I have for you here today. So I'll throw it over to Rob to close us out. And I hope everybody has a wonderful day and look forward to responding to your questions.
Yeah, just many thanks, appreciation for the partnership across the spectrum, you know, on this incredible challenge that you know, that we're all working together on. You know, the comment that I will very briefly close with, and this comes from the governor: if you have inventory of vaccine at the present time, and I know there's a lot of you on here that haven't received any yet, but for those that have, if you have any inventory right now, please be putting that into an eligible Missourian's arms. Don't wait. Please get that out, get that into someone. It is so very important. It will impact your ability to receive additional vaccines for your community in the future, and it will you know, impact the decisions that we make. And for those of you that have not received inventory yet, but soon will, you know, I'm going to ask you to do the same when you have that opportunity, to move that as quickly as possible into an eligible Missourian's arm. Our communities are counting on us. They're counting on us as a state. We're getting it out the door. Every single vaccine that our state's been allocated, we have allocated in and ensured shipment to a vaccinator in the state. We've done, you know, every single one. We're not sitting on anything. We ask that you not sit on anything, get these out because our folks are counting on us. We appreciate you. We're going to be incredibly transparent with as much information as we can. We're going to get with you all, and I know Lisa and her team answering questions and getting good information out, not only to you but to the public as well. So we can't thank you enough. Just ask you, you know, if you have vaccine in storage, to get it out this week, and then we'll do everything we can to get you some more. I appreciate it.